I'm now going to demonstrate administering an IV piggyback, and the patient has a PRN adapter site. So the first thing I need to do is grab my MAR, and I see I have an order for vancomycin, 500 milligrams, and that comes in a bag of 250 milliliters of normal saline. So of course I look up the drug to find out how to administer it, how fast to give it, and it says it needs to be at least over 60 minutes. Also I need to know the side effects, the actions, and all that information that I've already looked up. But for the procedure itself, we need to know that it's 250 milliliters and it's going to be given over 60 minutes. So I'm going to do my math on that. I have a calculator, and I'm going to use a primary tubing because it's going to be a long, just like a regular IV, we need a long tubing to go to the PRN adapter site from the IV piggyback. So I take my primary tubing, and it has a drop factor of 10. So the 250 milliliters is going to be multiplied by 10. That's 2,500, and then we're going to divide that by 60 because it's going to take 60 minutes. And we come up with about 42 drops per minute, and so that'd be about 10 every 15 seconds. So I just need to remember that. So I'm going to go to wherever the IV piggyback meds are kept and do my first check on my vancomycin. And I see that I have 500 milligrams and 250 milliliters of normal saline. So I've got that. I've checked that with my MAR. And then I'm going to prepare my bag by priming the tubing. So I open up my primary IV tubing. And because there's nothing at the end of it, we're going to need a alligator clamp to plug into the PRN adapter. So I'm going to grab an alligator clamp and put that on now. Keeping the tip sterile. And just gently push that in. And then it has a screw clamp that really actually holds it better. So I'm going to screw that on. Okay, and remember when you're priming an IV bag to prepare your tubing, you want to slide your roller clamp up a little bit and then close it. It's important to close it. Okay, got my vancomycin. And of course this isn't 250, it's only a little bit left, but we'll pretend that it's 250 milliliters in there. Remove the cap, and remove my tubing cap and spike it, keeping the cap tip sterile. Remember, close, spike, and then squeeze. So I want to squeeze to fill the drip chamber about halfway full. And then I need to prime my tubing. And of course the IV pole is a little bit lower than normal, just so that I could get it in the video. So you'd be having it a little bit higher than that. Okay, I'm going to remove my cap, and I like to just hold it right in the same hand. And then slowly open up my tubing, priming it into the trash. Now I want to hold it at waist level, not down here, but at waist level to keep it sterile, the tip sterile. If you have any air, you need to get rid of that. So the tubing is primed. And I could do my second check right now if I wanted to. Make sure I got the right thing. Vanco 500. My MAR says Vanco 500. And I also want to label my tubing because this tubing is going to be good for 72 to 96 hours depending on your policy. So I would put the date, time, and initial on my tubing. And I could be doing all this in the medication room. Now, because I know the patient has a PRN adapter, I've already assessed that, the physician just doesn't order it through the PRN adapter, we just know that that's what the patient has. So, by looking at the chart and the information. So what I need to do is drop 2 saline flushes. I'm gonna flush before I administer the medication to make sure that it's patent, so I'm not giving IV piggyback medication into the tissue. And then after the medication, I'll need another saline flush. Now, you may wanna draw that up later, or you could draw it up at this point, but what I'm gonna do is draw them both up now. Or if you had a pre-filled syringe, then you could just grab a pre-filled saline syringe. So I'm gonna clean the port off of my multi-dose saline, and I'm going to drop 2 milliliters, because in the lab we flush PRN adapters with 2 milliliters. You need to check with your, wherever you're doing clinical. Sometimes it's 3 milliliters, usually it's 3 milliliters that you flush with, but it depends on policy. Okay. So there's the flush. I'm going to just mark it with saline. Just put a little note on there that it's saline. And then I'm going to drop my post-flush now. Well, like I say, you may not be doing that until later, depending on, you know, if the medication takes an hour, you might be drawing that up later. Got 2 milliliters. We kept that. And again, mark it with saline sticker. Now, because I'm going to be at the site, I'm going to have some clean gloves with me too. So when I go in the room, I'm going to have, I only need 1 flush at this point, but I've got my 2 flushes just for demo purposes. An alcohol swab, and then I have my my medication here, and then my MAR. So I've got all my supplies to go into the patient's room. So I come in the room, I've washed my hands, I've identified the patient with 2 identifiers with the patient to the MAR. I've got my MAR with me. Explain to the patient what I'm going to be doing and if this medication, you know, what the medication does. Do my 3rd check again with my vancomycin 500 milligrams, vancomycin 500 milligrams. Important to check allergies, and I've checked to see if the patient has no known allergies. Okay. So I've washed my hands. I don't know if I said that yet, but I did. Put on my clean gloves. And first I just want to assess the site by visualizing it, to make sure there's no redness there. And I'm going to do my flush first. Hang my IV bag up here. And I'm ready to go. Clean the PRN adapter with some alcohol, and then flush it with saline. You just want to flush it slowly, over like 5 seconds, 5 to 10 seconds. And once I'm done with that, that's just going to go right into sharps. I'm going to plug in my IV antibiotic. And then I'm going to set my rate. And we said that this was going to go at 10 drops every 15 seconds or 40 drops a minute to get 250 milliliters in over 1 hour. Perfect. Okay. Now the only other thing that I would want to do before I left the room is to tape the IV tubing up alongside the the hand there so that it doesn't get pulled out. So let's say it's been an hour, and I come back in and I see that the bag is empty. I'm just going to shut it off. Now I don't want to be much longer than an hour, because if this is left empty and it's been 2 hours, this has been empty for an hour, you might find your site is actually clotted. So it's important to come when you're infusing with a PRN adapter shortly after the antibiotic is completed. And you probably would have been in the room prior to that, assessing that it's been running okay. But I see that it's all done, I've shut it off, and now I have brought with me a post-flush and another alcohol swab. And I'm going to remove the antibiotic, and I would have another alligator clamp with a clean top on it. So I would remove that and then have another sterile top, because I'm going to leave this here, and I can't leave this hanging with just that open. And then I'm going to post-flush. Again, we pre-flush to make sure it's patent, and we post-flush to keep it patent so that it doesn't clot up. And then the flush would go into sharps. And that's it for administering an IV piggyback through a PRN adapter. Now the only other method of giving an IV piggyback that I am not demoing, but I just want to talk about, is if you had an incompatibility issue. If you had an IV running, and then you were going to hang an IV piggyback into that running IV, I'm going to show that by demoing it here. Say we have a running IV. This is plugged in. And it's incompatible with the IV piggyback. Now the best option, of course, is to get either another site or a multi-lumen site, and that's usually what we do. But let's say that you had no other option but to administer it into an area. You could also remove this, actually, and plug in your IV piggyback and then plug that back in. But let's say you are connecting. If you are connecting to the incompatibility IV, then you're going to have to plug it in the closest port to the patient, because you don't want to mix with any of this medication. You're going to pre-flush it with at least 10 milliliters. I think some policies require 20 milliliters of saline after you've clamped it. So this is clamped all the way, your primary. You flushed it with 20 milliliters of saline, and then you plug in your IV piggyback, which is incompatible. Of course, I'm not flushing, but it would be flushed, it would be cleaned, and then we would plug it in here. And we can leave them right at the same height, because this one's completely shut off. We would set that, run it through, and after it's done, again, we need to flush with a lot of fluid, which is, like I said, usually 20 milliliters of saline. You don't run into that so much as we used to, for a couple reasons. Like I said, first of all, there's so many multi-lumen catheters now that that's usually what will happen in that case. And usually if you have an incompatibility, the IV, main IV that's incompatible is usually an IV that can't be stopped. Like, for instance, heparin or cardiac meds. So you don't want to actually stop that medication to administer something that's incompatible. So usually, like I said, the best option is to have 2 sites or a double lumen PICC line or center line. And that's it for IV piggyback through PRN adapter and IV piggyback through IV incompatibility.